Jessi Dillon. First abstract is a case of motor neuron disease with dementia and apraxia of the upper limbs. Journal Clinical Neurology. We report a 61-year-old right-handed woman with motor neuron disease, dementia, and apraxia of the upper limbs. The patient developed clumsiness of the right hand and dysarthria 2 years and a half prior to admission. Neurological examination showed limb kinetic apraxia and ideomotor apraxia, predominantly on the right side, in addition to dementia and anarthria. There was a mild muscle wasting in the neck and hands, a muscle biopsy from the biceps muscle of arm, as well as needle EMG revealed neurogenic changes compatible with motor neuron disease. Brain MRI indicated pyramidal tract degeneration. Three-dimensional brain perfusion imaging generated from SPECT demonstrated an asymmetric decrease in cerebral blood flow in the frontotemporal-parietal regions, predominantly on the left side. This case here suggests that asymmetric limb apraxia can be associated with motor neuron disease. The second abstract is use of neck magnetic resonance phonography, Doppler sonography, and selective phonography for diagnosis of chronic cerebrospinal venous insufficiency, a pilot study in multiple sclerosis patients and healthy controls. Journal International Angiology. Aim: chronic cerebrospinal venous insufficiency. CCSVI is a vascular condition characterized by anomalies of primary veins outside the skull that restrict normal outflow of the blood from the brain. CCSVI was recently described as highly prevalent in patients with multiple sclerosis, MS, and can be non-invasively diagnosed by Doppler sonography, DS, and invasively by selective phonography, SV. The aim of this paper was to investigate the value of neck magnetic resonance phonography, MRV, for the diagnosis of CCSVI compared to DS and SV in patients with MS and in healthy controls, HC. Methods: 10 MS patients and 7 HC underwent DS, 2D time of flight phonography, TOF, and 3D time-resolved imaging of contrast kinetics angiography, TRICS. MS patients also underwent SV.